Hi everyone, hope you're doing well and happy Women Wednesday. Today we'll be having a special guest on with us to discuss the Mpox vaccine and what the process and experience of getting vaccinated for Mpox is like. So stay tuned. We'll be beginning shortly as soon as we get our co-hosts in the room. So during the COVID-19 pandemic, Whitman-Walker's community health department has expanded its outreach efforts to include the social media platform, and we cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. Welcome, 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 Dr. Abbott. Thanks so much for joining us today.
Hey, how are you? Glad to be here.
I'm
I
good.
apologize. My phone started dying, and now I can't put it in the stand, so I'm trying to hold my hands.
Oh, no worries. But we appreciate your dedication by holding it up so we can see your gorgeous face throughout the live. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's community health team. Today, we're going to be discussing the Mpox vaccine, and we have a special guest with us today here to discuss the Mpox vaccine and their experience getting vaccinated. So please welcome Dr. Abbott, Dr. Stephen Abbott, who is a physician and medical site director at Max Robinson Center with Whitman-Walker in Southeast DC. Welcome, Dr. Abbott. Can you introduce yourself and your pronouns and tell us a little bit about what you do?
Sure. Hi, everyone. Thank you for joining us. My name is Stephen. I'm also known as Dr. Abbott. My pronouns are he and him. I'm an infectious disease specialist. I've been doing mostly HIV care and primary care in DC for over 10 years. I am medical site director at Whitman-Walker's clinic, Max Robinson Center in Southeast. I also work on 14th Street. And lately, our attention has been focused on Mpox, transmission, prevention, and treatment. So I'm glad we get to talk about it today. I hope people have questions that we can answer. Yeah, that's me.
Thank you. And yes, please, if you've got questions about Mpox vaccine or just Mpox in general, definitely drop them in the comment section and we will answer them as they come in. But to start off, let's give a definition to Mpox. So Mpox is usually a self-limited disease with symptoms lasting for about 2 to 4 weeks. And in severe cases, they can occur and lead to death, but this doesn't happen too often. Mpox typically presents with a fever, rash, and swollen lymph nodes, chills, exhaustion, muscle aches, and back pains, or backaches, headaches, a rash that can look like pimples or blisters, and these can appear on the face, inside the mouth, and or other parts of the body, like the hands, feet, chest, genitals, or anus, and it may lead to a range of medical complications.
Yes, and actually Mpox is not a new virus. I know that we've been living under the umbrella of COVID for the last 2.5 years, which actually was a novel virus that had not been seen before. Part of the reason why it was so deadly was that it was new and nobody had immunity. But Mpox has been around for a while. It's been endemic in certain parts of Africa where children will often die from it. There's a variant in Africa that's slightly more virulent with greater morbidity and mortality. But actually, if we had been able to eradicate it worldwide before this outbreak, then this outbreak would have never happened. It is transmitted through close to person contact. I often tell folks that although it is transmitted sexually, it's not a sexually transmitted infection. In fact, we're starting to see people who are sick with Mpox who have not had recent sexual encounters, and it's likely that they got it through holding hands, kissing, touching, or some other form of skin-to-skin contact that did not include sex. So we're trying to really decrease the stigma around the infection because it is not an STI, although we do get naked when we have sex, so there's skin-to-skin contact there. What else? It is affecting mostly MSM or gay and bisexual men. This is simply an epidemiologic fact. It's not because we are somehow more susceptible to it. It's not that it is a gay disease. It is a virus that is transmitted through skin-to-skin contact, and it looks like it may have started somewhere in Europe around a series of circuit parties. where there is often lots of skin-to-skin contact. And then unfortunately, these events occurred right before Pride, and we all know that we were quite happy to be out and about in June after being under COVID restrictions, and there was lots of skin-to-skin close contact. So that's probably why the rate of transmission has picked up so quickly. And the goal is to actually get as many people vaccinated as possible in high-risk categories to break the chain of transmission so that we can decrease the number of new cases and hopefully bring this most recent pandemic to a stop.
Thank you for that information. So you recently got vaccinated for Mpox. We'd love to hear more about your experience getting vaccinated and what it was like to sign up for the vaccine and go through the registration process and all of that good stuff. So how was scheduling your appointment, and what did you have to do to schedule your vaccine appointment?
So the vaccine currently is only available through the Department of Health. The Department of Health gets the vaccine through the CDC and the federal government. There is actually a stockpile of vaccine. This vaccine was developed to treat smallpox, or actually, I'm sorry, to prevent smallpox. In the event that there was a bioterrorist attack, we wanted to be sure that we had vaccine on hand to be able to handle that type of event. Mpox, smallpox, and cowpox are all in the same category of vaccines, the same family. And so.
Oh, Dr. Abbott, I don't know if you hit mute. I don't know if you might have hit the mute button or something. I can't hear you right now.
I'm sorry.
Okay, I can hear you again.
What was I rambling on about? What was the last thing I said?
You were talking about Mpox, cowpox, and smallpox being in the same family of vaccines.
Okay. So the vaccine that we are now giving folks to prevent Mpox was developed to prevent smallpox. And because the two viruses are very similar, it is effective against Mpox. The way that you would be able to get access to the vaccine is signing up to the DC Department of Health that gets an allotment of the vaccine from the federal government. We are allotted a number of doses based on the rate of infection or positive cases within our community. And then the Department of Health has a very efficient system for distributing the vaccine based in part on the experience with distributing the COVID vaccine. But when you go to the website, which I think we're going to provide in a link at some point, you click the button that says pre-register. When you pre-register, you have to fill out a form. The form will ask demographic information, name, age, race, sex assigned at birth, gender identity, sexual orientation, and then it will ask some questions about your employment, screening for whether or not you work in an environment that might put you at risk for exposure, and then number of sexual partners. And then based on your potential risk for exposure, you're eventually offered an appointment to either schedule on Georgia Avenue at their vaccine site or down on I Street. I got my invitation for my vaccination about 3 days after I registered. To be perfectly honest, my for lack of a better word, body count is not particularly high. I was kind of surprised that I got my invitation. I think one of the reasons is the number of folks registering was high initially, and then it dropped off. And now I really encourage people to go on and register so that we can continue to get the vaccine out. And when you register, it gives DOH, the Department of Health, data to present to the feds to say, look, this is how many people want the vaccine. This is how many doses we're requesting based on the epi of the virus in the area and the demand for the vaccine. So even if you're not sure you want to get it, please fill out that form so that we can increase the number of doses that we receive in the city. Once you register and you get the invitation to make an appointment, you select the site. On the day of your appointment, you arrive 10 minutes early. They check you in. It's usually 3 healthcare workers that check you in, give you a form to fill out. They give you a number. You sit down. They call you by number. They never use your name, except when you sit down to get the shot. And there's a waiting room where you wait to get called. Then you move over to another room where they're giving the vaccine. They call you by number. They confirm your identity when you're sitting next to the person administering the vaccine. It's a sub-Q injection. It goes under the skin. It's not deep into the muscle like the COVID vaccine was. And then you're offered an opportunity to wait for 15 minutes or you can leave. Traditionally, we ask folks to wait for 15 minutes to make sure they don't have a vaccine reaction. And then they were initially planning to do 2 doses. We've now switched to a strategy where we'll do 1 dose. 1 dose of the vaccine offers protection for at least 2 years. The second dose traditionally is given to give you lifetime protection, but because we have fewer doses, by only giving 1 dose, you're actually able to double the number of people we vaccinate. So we're hoping that we can bring things to a point where enough people are vaccinated that the transmission starts to slow down, and then eventually we can all get our second dose at some point in the future. I will say that it was an incredibly efficient experience. I thought I would be waiting for a lot longer when I got there, but I was in and out in 30 minutes.
Thank goodness for all that COVID vaccine distribution practice. Where did you have to travel to get your Mpox vaccine?
So there are 2 sites. One is on Georgia Avenue in Northwest. It's close to the Silver Spring line. And then the other one is on I Street. I don't know exactly where, but I took an Uber. It was like less than 10 minutes from where I live. But there are also going to be pop-up events. So if you do register, they may end up sending you a link to come and get your vaccine at a community organization that's hosting some of these pop-up events that they plan to have. They really do want to reach out and get to everyone. So they'll be doing events in Ward 7 and 8 to help make sure that the vaccine is distributed evenly, let's say.
We love equitable healthcare, right?
Healthcare, yeah.
So did you experience any symptoms after you got your vaccine, like soreness at the site of the injection, or feeling ill afterward, or anything? Or what can people expect?
Jewel, I'm going to share something with you. I did my vaccine on a Sunday, and I was really hoping I would have a fever on Monday, so I could take the day off from work.
Oh,
but I felt fine. I went to work on Monday. All I ever felt was a little bit of soreness in my arm. It lingered longer than I expected, but I've talked to some other people, and their arms were only sore for 1 or 2 days. Mine seemed to be sore for a whole week, but other than that, I was fine. I never had a fever. I never had any body aches. Nothing.
Oh, thanks for sharing that. And fingers crossed that if and when we get to the point where people are getting second doses, it does give you the fever to be able to call out of work.
I have 140 sick days. I have an excuse to use one.
Well, I guess I'm happy to hear that as a provider, you've got a really strong immune system. Like that, that's good to hear. Is the Mpox vaccine safe for people who are living with HIV?
Yes, it has been studied in people who are HIV positive. The only difference between somebody with a robust CD4 count who's positive and someone whose CD4 count may be a little bit lower is the response to vaccine. We think that if you're on the lower end of a CD4 count, maybe below 200, that you'll get a response, but it won't be quite as robust as if your immune system were a little bit stronger. However, some response is better than no response at all. It's sort of the way we look at the flu vaccine. So we give flu to everybody regardless of their CD4 count, and I think that Mpox is the same. So although you might not amount the same response, you will have some immunity should you get exposed at some point in the future.
Okay, that's great to know, especially as a provider that provides so much care to people living with HIV. So it's safe for folks who are living with HIV.
Yes.
How long does the vaccine, what would you say to anyone who is eligible to be vaccinated against Mpox and they're feeling hesitant to do so?
Well, I would, like I said before, encourage you to at least register so that we can continue to lobby for more doses of the vaccine. If you're hesitant, be aware that this virus is transmitted very stealthily, that there are people that I'm seeing in clinic who don't have any obvious exposures, sexual or otherwise, and yet have the full-blown rash. If anybody's old enough to remember chickenpox, when I was a kid in elementary school, every now and then there'd be a chickenpox outbreak. And so some class might be out for like 2 to 3 weeks due to the chickenpox virus and the rash that came along with that. This is very similar. You go through a fever, body aches, and then you develop this rash, and you have to isolate until the rash is gone. And sometimes that rash can take up to 4 weeks to go away. You get little pocks, little marks, little blisters that eventually scab over and fall off, but they come in stages, and so you may have it completely resolved on your chest, but then you've got new lesions on your legs, and it's going to take time for those new lesions on the legs to go away. So it can be. I saw someone on Monday who's still having lesions after almost 3 weeks, and he has to continue to isolate because any open lesion is still contagious. You can't go back to, or you can't come out of isolation until all of the lesions have scabbed over, fallen off, and new skin has come in behind them. So although this isn't a virus that's going to end up putting lots of people in the ICU on ventilators with multi-organ failure, it is going to inconvenience you for 2 to 4 weeks. So it's certainly okay not to get vaccinated. Just be aware that that may be the consequence of not getting vaccinated.
And so it's like, are you prepared financially and grocery shopping wise and just homestay wise to be out for 2 to 4 weeks as well?
Yep,
So
exactly.
how long? Sorry, pardon me.
I said exactly. Yes.
Cool, cool. So how long does the vaccine take to start offering protection against Mpox?
2 weeks. So once you're vaccinated with that first dose, you should really try to continue to be cautious for 2 weeks, and then after those 2 weeks, you should have immunity for 2 years.
Wow, that's great. And can you tell us a little bit about what Whitman-Walker's response to Mpox and battling Mpox in the district is looking like? And what
So
people can
although we
expect?
don't have access to the vaccine, we've been doing media blitzes like this and pushing out text messages encouraging people to register through the Department of Health. We've also started offering half a day clinic sessions specifically for people who may have been exposed or have active lesions, more specifically people with active lesions, so they can come in and get tested and in some cases get treated. Again, unlike the beginning of COVID where we didn't have testing and treatment ability, we do have that with Mpox. So I encourage folks, if you are a Whitman-Walker patient and you're worried about a new rash, particularly if it's occurring after a fever, to please call and ask specifically for an Mpox clinic appointment. And then we can do the testing there. And in some cases, we'll start treatment. This treatment is coming from the federal strategic stockpile for smallpox. Again, it's a medication that was developed for smallpox, but it can be used for Mpox. However, it's under a particular FDA distribution, so I can't write a prescription and have you go to CVS. You got to come in and go over some paperwork and talk about how long you're going to take it, where you're taking it, and then sign a form. So if you do have it and it's in near your eyes, in your mouth, in the back of your throat, in your anal canal, causing pain and bleeding, or if it's causing difficulty urinating, those are all good reasons to come in and get treated because we don't want those symptoms to get worse.
Exactly. And I believe, Whitman-Walker's offering, we have a sexual health clinic a couple times a week. And so if you're experiencing symptoms in your throat or your anus in terms of Mpox, you can call us at 202-745-6175 to schedule a sexual health clinic visit. And you don't have to be a patient with us to do that either.
Or if you have any open lesions or sores or a rash that you're worried about. So,
Yes.
yeah.
So can you share a few vaccine facts with us? Like who's the maker of the vaccine, what's in it, and like, what can people kind of compare this vaccine to and just what the common side effects are?
So it's a live, what we call it live attenuated vaccine. So it actually is a live virus that does not replicate. So it will teach your immune system what monkeypox looks like without giving you the actual full-blown illness. Other live vaccines include measles, mumps, rubella, flu. I'm blanking on another one.
Chickenpox.
Yeah, chickenpox and yellow fever. So live viruses are not new. They are modified so that they don't make copies of themselves after they've been injected into your body. They're highly effective at producing an immune response. They offer you protection, like I said, for the first dose for up to 2 years. It can also be used to treat people in what we call post-exposure prophylaxis. So if you've come in contact with somebody who then is diagnosed with Mpox, if you get the vaccine within the first 4 days of your exposure, it can decrease your risk of actually developing illness. So that would be another reason to reach out to get vaccinated.
Wonderful. And again, the sooner that you get your vaccine after an exposure, the more likely it is to work. So if you have no exposure to Mpox, contact your local health department for vaccination. And if you're a DC resident, please call DC Health and Wellness at 202-741-7692. Again, that's 202-741-7692, and you can access the vaccine as post-exposure prophylactic.
And one question I've been asked is from folks who may have been vaccinated for smallpox when they were kids, do they need to get the Mpox vaccine? And the answer is yes, because what happens is as you get older, and so the smallpox vaccine basically phased out in the United States over 50 years ago. So by now, it would essentially be not effective if you've been vaccinated as a kid. So although if you got it in another country, if it's probably been more than 10 to 15 years. So you should consider getting the Mpox vaccine. Smallpox vaccine as a kid won't protect you.
Thank you for that. Super helpful. Finally, if you are a DC resident and you're looking to access the Mpox vaccine, you're currently eligible to be vaccinated if you are a district resident, 18 years of older, and you identify as a gay, bisexual, or other MSM, or man who has sex with men, and you've had multiple or sex partners or anonymous sexual partners in the last 14 days, or if you're a transgender woman or non-binary person who was assigned male at birth who has had sex with men, or if you're a sex worker or of any sex, or if you're a staff member of any sex at establishments where sexual activity occurs, like bathhouses, saunas, and sex clubs. And please just note that you'll need to have a proof of residency in order to be vaccinated. So that's an ID card that has a DC address, a utility bill or other piece of mail with your name and a DC address on it, or a current DC lease or mortgage with your name on it. You can visit dc.gov if you're a DC resident to access more information about the monkeypox and the attestation and signing up for appointments. For Maryland residents, you can visit maryland.gov, and for Virginia residents, you can visit virginia.gov and visit their health department websites to find out more information about getting vaccinated in those respective states. But I want to thank you all so much for taking some time to learn a little bit more about the Mpox vaccine, and thank you so much for joining us, Dr. Stephen Abbott. Do you have any final messages to share with our audience members today?
Well, I know there's a lot of anxiety and concern out there in the community, myself included. I mean, we reached a point where we thought it was safe to go outside, and now we're dealing with another pandemic. I would like to encourage people to just take a deep breath. This is not another COVID pandemic. This virus has a vaccine, it has treatment, and it's not a virus, like I said before, that's going to land you in the ICU with multi-organ failure. So it may inconvenience you with a rash for 2 to 4 weeks. Please register to get vaccinated, even if you're not sure if you fit in one of those categories, because they will continue to modify the criteria based on the outbreak and the vaccine allotment we receive from the federal government. And if you have any questions, please reach out and talk to your healthcare provider.
Thank you so much, Dr. Abbott. So my big takeaways from today are pre-register for the vaccine. This vaccine is not sexually transmitted, and it's not localized to the LGBTQ community. Anyone can get it no matter what their sexual orientation is. And if I were exposed to it, I should definitely consider getting vaccinated as well, because it can help protect me and any person who finds himself in that position.
Yes.
Awesome. Well, since we are in multiple public health pandemics at once, before we go, we want to give you a few more reminders about the COVID-19 vaccine. If you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself and your loved ones and community from getting sick. Multiple variants have soared across the US and the world, and it's totally understandable if you might want to keep wearing your mask, as the vaccine isn't 100% effective at preventing new cases of COVID-19, but it is very effective at keeping you from getting very sick with COVID, from ending up in the hospital of COVID, and from dying of COVID-related complications. So please stay alert, and thank you so much for doing your part in helping keep the community healthy. If you haven't been vaccinated yet and you're looking for an appointment, Whitman-Walker Health does have COVID vaccine available, so just give us a call at 202-207-2480 to make an appointment. Again, that's 202-207-2480. And if you're having trouble making an appointment with us or we're just not nearby you and you're a DC resident, you can visit vaccinate.dc.gov or call 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with people who are around you, and just be mindful of masks and keeping your distance, but especially when you do not know if people are vaccinated or not. Thank you again, Dr. Abbott, for joining us. Please follow along with Whitman-Walker on social media at Whitman-Walker on Facebook, Twitter, and Instagram. You can find more information about Mpox and COVID-19 and our services at whitman-walker.org. And you can follow our family accounts at RealTalkDC _ and at NoFilterDC.
Thank
you all. Have a good rest of your day.
Bye, everybody.